they focus on the nervous system. If you look at this model, the brain sits here in your skull and it sends messages down your spinal cord, out these little nerves at every single level. This brain is responsible for every single thing that your body does. Every structure, function, and coordination that the body does is controlled by the brain, and it's done via the spinal cord. So what happens when these bones move and put pressure on these nerves? Well, I'll tell you. The nerves can't function. If the nerve can't function, then the destination that the nerve is trying to get to can't get the message. So if my brain is trying to tell my stomach to digest food, but there's a blockage in that nerve, the stomach doesn't know what to do because it can't receive the message. So as chiropractors, what we do is we find which nerves are blocked by a subluxation, and we remove that blockage so that that organ can function or that tissue can function. Again, this nervous system, controlled by the brain, it does everything in the body. The things we can think of, which is walk, talk, see, breathe, all that stuff that we know we do on a daily basis. But what about the things that you don't think about? What about blinking your eyes? What about your heart beating? What about your stomach and your digestive system digesting food? All that's controlled by the nervous system, so it's very important that this organ can function. So vertebral subluxations, what they do is they put pressure on nerves. They can also put irritation on nerves. So as a chiropractor, what I do for my patients is I find which joints, which segments have dysfunction in them and it's causing this pressure or irritation. Once I remove that pressure and irritation in the nervous system, the body has the ability to heal itself. It's the same reason why you don't have to think about it when you cut your finger. It's not the Band-Aid that heals your finger. It's not the Neosporin that heals your finger. It's your brain, it's your nervous system, it's your body. So my job as a chiropractor is to always find where in my patients is there stress on their nervous system. Again, these things are called vertebral subluxations. Every single one of these bones in the spine can move. They should move individually. And what happens is they get misaligned and they turn different ways and they become non-responsive to the stresses in the daily life. So if we can't respond and adapt to our daily stresses that we go through, which is physical stress, it can be chemical stress, and it can even be emotional stress. If our body can't tolerate those and it can't adapt and respond to them like it should, we get vertebral subluxations. And again, that's pressure on a nerve, irritation in a nerve caused by a misaligned spinal bone. My name is Dr. Alduan Martin, and that's chiropractic in a nutshell.